Hi, I'm Nilesh, Jain, founder at CliniVantage. There's been a lot of buzzword around patient-centric care and how technology is going to help and assist in the long term with better outcomes around this. A lot of companies are focusing on sort of the B2C model where we're creating a longitudinal record and providing this information at a personal level. But I think patient-centric care is more driven towards the outcome and more towards long-term care versus just managing an episode. And I'll give you an example. Let's take diabetic care. Today, there are enough wearable devices, enough endpoint devices that can measure blood glucose, but there isn't a platform or a connected system where these daily vitals can be pushed onto capturing this data, give it to the doctor or the caregiver, and then make informed decisions on the long-term trends. And I think that's where personalized medication is going to move towards, is looking at longitudinal long-term care for both chronic care diseases as well as short-term episodic conditions, for example, post-operative care. So when we talk about technology, there are a lot of miniaturization of these devices and equipment that is now coming into the medical field. And how do we take this information, connect it back to the doctor, care provider, and make informed decisions going to be critical. Also, when we talk about clinical pathways, at CliniVantage, we're fundamentally working of how we're going to drive solutions for long-term care. And for example, let's look at diabetic care. As a patient, when I start measuring my vitals, there isn't any informed decision that the doctor or the nurse or the hospital is making for me. Also, how do we look at the efficacy of the drugs that were prescribed to me? Are there fluctuations? Is it getting better? Is it getting worse? How do we manage that? And I think technology platforms like CliniVantage can help us look at this transformational story. So today we're working with hospitals, doctors, to look at how long-term care can be managed, where the patient is at the center of the caregiving, and also informed decisions can be made by every partner in the healthcare ecosystem. And I think in future, this is where we're going to head, is look at long-term chronic care management, look at post-operative care, look at certain conditions like dialysis, and how do we help patients manage that on a day in and day out basis. There's a lot of technology being innovated, both from a hardware perspective and from a software perspective. So when we look at AI, ML engines, when we look at some of the algorithms that are being built around patient-centric care, especially in oncology, we're looking at gene-based therapy. We're looking at early diagnosis in certain areas, which can help us overall reduce the cost, and also look at long-term care for these patients and look at the trends as to whether they're going to be accessible to this kind of technology or no.